China doctor reacts to massive cancer breakthrough. Doctor explains miracle anti-cancer treatment. Traditional Chinese medicine, known as TCM, is the traditional medical system of China with a rich history dating back thousands of years to ancient China. TCM's theoretical foundation is primarily based on concepts such as Yin-Yang, the five elements, Qi, and blood. It emphasizes a holistic approach, viewing the human body as an organic whole. TCM employs diagnostic methods that include observation, listening and smelling, questioning, and pulse diagnosis. These methods are used to determine the underlying causes of illness. Treatment modalities in TCM mainly involve the use of Chinese herbal medicine, acupuncture, and cupping therapy, aiming to rebalance the yin and yang within the body and facilitate self-healing. TCM places a strong emphasis on prevention, highlighting the importance of maintaining the overall balance of the body to prevent the onset of diseases. In the modern era, TCM continues to be widely practiced in China and various other regions. It plays a role in the management of chronic illnesses, rehabilitation, and health maintenance. While TCM's theories and methods differ significantly from Western medicine, they reflect China's unique understanding of health and disease, offering distinctive approaches to healthcare. In the realm of cancer research, decades of observations on the blood and microbial constituents in cancer patients have yielded diverse results. This eventually prompted the National Institutes of Health in the United States to launch a comprehensive investigation into whether cancer is caused by viruses. In the 1970s, this inquiry, famously known as President Nixon's War on Conquering Cancer, led to a significant revelation. It revealed that the so-called cancer-causing viruses were actually the result of biochemical imbalances within the body. While these viruses might manifest before the onset of cancer, they were not the root cause of the disease. This fact, which had been established by numerous prominent cancer research institutes over more than a century, challenged conventional wisdom. Source: Modern Medical Critique, page 40. In the 1970s, many medical experts from China traveled to the United States to study chemotherapy and subsequently disseminated this approach upon their return. Today, millions of cancer patients in our country succumb to the disease, tragically and unjustly. It appears that the belief in cancer being caused by viruses has led modern medicine down a treacherous path. The prevailing approach involves aggressively targeting these supposed viruses with chemotherapy, drugs, and lasers, yet the cancer viruses remain elusive, while patients often suffer fatal consequences. It's akin to consulting a shaman to cure an illness, and the shaman claims the patient is possessed by evil spirits, advocating for a brutal whipping to exorcise them, but instead, the patient perishes. Comparing this situation to studying the molecular structure of water molecules to understand the flooding of the Yellow River or the Yangtze River might seem absurd. Similarly, focusing on cancer cells or cancer genes for cancer treatment may be misguided. Despite scientific advancements, the research direction remains flawed, inadvertently hindering rather than aiding modern medicine's progress. Life is like a flowing stream journeying from the mountaintop to the sea, a temporal and spatial process. Accumulated sediments in the stream mirror the toxins forming lumps within the human body. Just as no accumulation can halt the flow of life, no lump can cease the breath of life. Considering that discovering cancer cells can predict life's peril is as illogical as believing that analyzing the constituents of sediment in a riverbed can prevent a major flood. Surgery cannot eradicate the root cause. Chemotherapy and radiation therapy prove deadly. Today, the mere mention of cancer leaves people feeling weak, pale, and fearful. For instance, a retired high school teacher, suffering from a mild fever, spent 3 months in the hospital without improvement. Frustrated, he demanded to know his diagnosis. The doctor, unable to evade the inquiry, reluctantly disclosed, "You have lung cancer." The next day, consumed by overwhelming fear, the teacher passed away. Unfortunately, Stories of individuals who succumb to cancer-related fright are not uncommon. Drawing from nearly half a century of medical practice, it becomes apparent that cancer is not an absolute death sentence, and there is no need for excessive panic. The key issue lies in an excessive reliance on hospital-based medical treatments, which often prove more detrimental than beneficial. The author contends that upon evaluating all the diagnostic and treatment methods in modern medicine, the fundamental logic underlying these approaches is fundamentally flawed. Most diagnostic data derived from tests represent outcomes rather than root causes, and the majority of treatment objectives address symptoms rather than underlying causes. Early Western medical approaches to cancer solely focused on surgical removal of cancerous lesions. However, these lesions merely represent the culmination of a disease rather than its origin. Modern medicine asserts that surgical removal of these lesions amounts to eradicating the root cause of cancer. People genuinely believe that surgery can uproot the disease. This belief mirrors the fable of covering one's ears while stealing a bell. Cancer patients rush to undergo surgery upon hearing their diagnosis. However, they fail to recognize that the underlying causes of cancer persist after surgery, depleting the body's self-regenerative capabilities and hastening cancer recurrence. Doctors then resort to additional surgeries. This continual cycle of surgery, aimed at addressing consequences rather than causes, exacerbates the harm inflicted on patients and fails to combat cancer effectively. Surgery only provides an illusion of resolution, while the true cause, the body's compromised vital processes leading to cancerous growths, remains unaddressed. After numerous casualties due to surgical treatments, the medical community finally recognized the oversight regarding the true causes of cancer. Throughout the history of Western medicine, there have been countless instances of erroneous assumptions about disease origins. For instance, theories like Ryan's autointoxication, Parathobsthemic lymphatic constitution, Bickett's lesion infection theory, and many others. In 1901, the Rockefeller Institute in the United States posited that chickens could transmit cancer to one another, attributing cancer to viral infection, a belief that persisted until 1970. While the virus was never found, chemotherapy drugs designed to kill the virus had long been in use. This marked the advent of chemotherapy, which claimed countless lives worldwide. As chemotherapy yielded limited success, radiation therapy was introduced as another method to target cancer cells. From surgical interventions to chemotherapy and radiation therapy, more than 7 decades have passed in the United States. What have been the results? Dr. Harding's research provided a clear answer. Over these 70 years, the combination of surgery, chemotherapy, and radiation therapy deprived countless people of any hope of survival. In our country, statistics show that there are approximately 2.2 million cancer patients each year, with 1.6 million succumbing to the disease. Those who perished are beyond help, but for the living, it is essential to reconsider the path of cancer treatment and avoid eroding their prospects for survival. In the 1980s, a new theory emerged in the field of cancer etiology, proposing that mutations in a patient's cell genes were the cause. Some even claimed to have identified specific cancer genes for cancer prevention and treatment. Whether this theory holds water remains uncertain, but it underscores the fact that both the virus and hereditary theories have been inaccurate. As for the genetic theory, the author remains skeptical, awaiting verification through historical practice. As previously mentioned, while microscopic examination of cancerous growths may contribute to scientific knowledge, it bears no direct relevance to the causes of cancer or its treatment methods. This is analogous to studying the composition of mud in a riverbed to develop flood prevention strategies for the Yellow River, an endeavor that would be regarded as absurd. Unfortunately, our current approach to cancer pathology research perpetuates such absurdity. Dr. Lewis Thomas, a member of the National Academy of Sciences in the United States and the chief of the departments of Pathology and Internal Medicine at New York University Bellevue Medical Center, as well as the director of the Department of Pathology at Yale Medical School and the president of the Sloan Kettering Cancer Institute in New York City, remarked, "Many actions taken in cancer treatment, surgery, radiation, and chemotherapy are half-hearted techniques because these measures are aimed at cells that have already become cancerous, rather than addressing the mechanism by which cells transform into malignant growths." Thomas's words accurately reflect the failure of cancer treatment. However, his insights remain confined within the microscopic framework of cancer treatment. This is because anatomy, as a foundational discipline, has long steered them towards micro-level research. Undoubtedly, surgery, radiation, and chemotherapy all focus on outcomes rather than causes. These treatments inflict severe trauma on the patient's body, yet offer no real benefit in combating cancer. Surgeons persist with surgical treatments because they bring wealth to their hospitals and personal financial gains. While new doctors can learn surgical techniques, which may lead to promotions, regrettably, cancer patients become the sacrificial lambs in this process. Chinese herbal medicine in traditional Chinese medicine TCM refers to a variety of plant parts such as roots, stems, leaves, flowers, fruits, seeds, as well as natural substances like minerals and animal products. These substances are used for medicinal purposes to regulate the body and treat ailments based on the traditional theories of TCM. Chinese herbal medicine is often prescribed as part of a formula, and different combinations of herbs can target specific symptoms or constitutional differences. Some common Chinese herbs include 1. Ginseng, considered a tonic herb, often used to boost immunity, increase stamina, and alleviate fatigue. 2. Astragalus, employed to enhance the immune system. It is commonly used for preventing colds and promoting recovery from fatigue. 3. Xuanxiang, used to promote blood circulation and soothe meridians, frequently employed for treating headaches and irregular menstrual periods. 4. White peony root, known for replenishing blood and qi, as well as promoting blood circulation. It is often used for gynecological issues and pain symptoms. 5. Goji berry, thought to benefit the kidneys and improve vision. It is used for kidney function support and vision improvement. 6. Chinese Angelica dangui, often used for regulating menstruation and nourishing blood, particularly for treating female physiological issues. 7. Tangerine peel, known for promoting qi circulation, strengthening the spleen and stomach. It is used for alleviating chest congestion and digestive discomfort. These are just a few examples. Chinese herbal medicine encompasses a wide range of varieties and applications. The selection and combination of herbs are typically based on the principles of TCM differential diagnosis, taking into account individual differences in a patient's constitution, symptoms, and causes. When using Chinese herbal medicine, it is advisable to consult with a licensed TCM practitioner to ensure proper herb selection and dosage. Do you have a grasp of the perils associated with chemotherapy for cancer patients? Chemotherapy, abbreviated as in Chinese, stands as one of the 3 primary approaches to treating tumors. Its advantage lies in its systemic therapeutic effect. Chemotherapy encompasses curative, neoadjuvant, adjuvant, and palliative chemotherapy. Curative chemotherapy aims to completely eliminate or control the tumor. Neoadjuvant chemotherapy is administered before surgery to shrink the tumor, facilitating better surgical removal. Adjuvant chemotherapy targets residual or dormant lesions for further treatment. Palliative chemotherapy is administered to late-stage or elderly patients to provide relief, alleviate symptoms, and extend life. Chemotherapy refers to the use of chemical drugs to eradicate malignant cells or abnormal lesions within the bodies of cancer patients, while chemotherapy can assist in treating severe illnesses. It often not only eliminates abnormal cells, but also inadvertently targets normal cells. These normal cells are essential for the proper functioning of the body, and their destruction can significantly harm the patient, even leading to a substantial decline in immunity. Chemotherapy is a commonly used anti-tumor treatment method in clinical practice, but it comes with certain side effects, which are the hazards of chemotherapy. 1. Following chemotherapy, patients may experience a decrease in white blood cell count and a reduction in hemoglobin levels. It can also lead to gastrointestinal reactions, such as nausea, vomiting, and decreased appetite, resulting in a significant loss of body weight and a decrease in the body's immune and resistance capabilities. 2. It poses a risk to the liver, and in severe cases, can lead to cirrhosis and disturbances in the coagulation mechanism. 3. It can harm the respiratory system, with respiratory failure occurring in severe cases. 4. Hair loss is a common reaction in the body. After understanding the hazards of chemotherapy, it is essential to be aware of 6 prohibitions that cancer patients should observe during chemotherapy. 1. Avoid consuming large quantities of carbonated beverages. 2. Refrain from consuming highly sugary, oily, or spicy foods. 3. Do not overeat. Instead, opt for small, regular meals to maintain a balanced diet. 4. Avoid high-fiber vegetarian foods such as corn, soybeans, celery, and bitter melon. While these foods are generally beneficial for cancer prevention, they may be challenging for the delicate gastrointestinal system of cancer patients undergoing chemotherapy. 5. Refrain from consuming coffee, tea, and alcoholic beverages. If diarrhea occurs while consuming dairy products, discontinue their use. 6. Avoid strenuous exercise after meals. Aim for restful bed rest. And try to avoid tight-fitting clothing and environments with strong smoke and fumes. In our daily lives, it is crucial to pay attention to the above 6 points as they can contribute to the restoration of one's physical health. The foregoing is the information I have shared regarding chemotherapy. I am Dr. Yang, an oncologist. Currently, major hospitals in Beijing have introduced online consultations. If you have any health concerns, please feel free to leave a message, and I will do my best to address them during my free time. Your support and attention are greatly appreciated. Foreign patients embrace traditional Chinese medicine, a fascinating trend. In recent times, there has been a remarkable surge in interest among foreign patients in seeking traditional Chinese medicine TCM for their health concerns. Many have come to view TCM as a scientific and highly effective approach to healing. One user, going by the handle Hannah, shared an intriguing anecdote. She recounted how her foreign friend, feeling unwell, had asked her to accompany him to a TCM clinic in Beijing's famous Tongren for acupuncture and herbal remedies. Interestingly, the doctor hesitated, concerned that the foreigner might not know how to prepare herbal decoctions and offered to provide pills instead. However, the determined patient insisted on personally brewing the herbal remedies. Hannah patiently explained to her friend the deep reverence Chinese people hold for traditional medicinal herbs. The enthusiastic foreigner even expressed plans to shop for herbs after receiving his next paycheck. Another user, TCM, engaged in a thought-provoking conversation with a TCM practitioner practicing in the United States. This practitioner noticed an intriguing phenomenon. The majority of patients seeking TCM treatments were foreigners, while there were relatively few Chinese seeking TCM in the Western world. When asked about the reasons behind this, the practitioner humorously attributed it to the potentially higher cost of TCM treatments overseas for Chinese nationals. Moreover, Chinese immigrants often embraced modern Western medicine, helping to benefit from advanced medical technology. In contrast, many Westerners turn to TCM after recognizing the limitations of conventional medicine, sometimes even after experiencing its shortcomings firsthand. One foreign healthcare professional expressed an inexplicable love for TCM. Despite being from the Western world, they envisioned TCM as a source of wisdom that transcended borders, races, and nationalities, contributing to the well-being of all. TCM in their eyes was not just effective but held a touch of the miraculous. Ni Haixia, a proponent of TCM in the United States, shared a candid observation. He found it disheartening that while in the U.S., it was predominantly the Westerners who embraced and promoted TCM as a scientific discipline with thousands of years of history and remarkable utility. So why do foreigners flock to TCM and shower it with praise? The answer lies in the opportunities for recovery and, in some cases, the gift of a second lease on life that TCM offers them. TCM is not merely effective, it possesses an aura of the extraordinary. According to Liu Muqiao, the general manager of Shanghai and Chang Hospital Management Consulting Co., Limited, TCM undeniably demonstrates its efficacy, especially in treating conditions such as skin diseases, chronic pain, severe illnesses, and fertility issues. In London, a city often cloaked in mist, conditions like eczema are prevalent, but TCM has shown remarkable results in its treatment. Unlike Western medicine, which often relies on painkillers for managing pain, TCM's acupuncture can provide immediate relief, sometimes with astonishing results. Even for ailments like cancer, often considered a death sentence in Western medicine, TCM interventions frequently exceed expectations, leaving foreigners in awe and unwavering in their trust in this ancient healing art. In conclusion, the growing popularity of traditional Chinese medicine among foreign patients is a testament to its undeniable effectiveness and the hope it brings for healthier lives. Foreigners, drawn by TCM's mystical efficacy, have come to see it as a beacon of hope and a path to recovery, transcending cultural boundaries and leaving a lasting impact on the world of healthcare.